Buccal fat pad removal has definitely taken a hit in social media lately. I've noticed that even my own practice has slowed down significantly as far as buccal fat pad removal, and people cite looking gaunt or regretting this operation later in life. But in my own practice, I don't really see that. If anything, people wish that they had more of a result, and the result might be a little too subtle. But I've also really started to observe some results, and I've come to some conclusions about what makes buccal fat pads good and what they confer to one's beauty that should be considered prior to removing buccal fat. If you're interested in my thoughts, stay tuned. Hi everybody, I'm Dr. Jonathan Zelken, a board-certified plastic surgeon in Newport Beach, California, and I'm here today to talk about buccal fat pad removal once again, as well as facial sculpting as a whole. Really consideration of the lower face and the soft tissue and fat compartments as a whole, a harmonious whole, is incredibly important. Buccal fat pad removal is a oftentimes simple and gratifying procedure that in and of itself can convey a degree of beauty that can't be met by many other procedures. So even though it's invasive, I find buccal fat pad removal to be a lot less downtime. It confers a lot less downtime than, say, liposculpture or other things that take 6 to 12 months for a result to truly manifest. And the incisions are obviously hidden inside the mouth and things like that. But before I talk about what makes buccal fat good and why you might not want to remove it, let's just take a quick overview rehash course about the anatomy. When I think of facial sculpting, I think of the upper half of the face and the lower half of the face. The upper half of the face is everything basically above an imaginary line between your tragus and the base of your nose, and your hairline. And the lower half would be that down towards your chin or your collarbone, depending on how you want to consider it. But if we consider the lower half of the face, everything between an imaginary point between the tragus and corner of your mouth and the jawline, then there's kind of thirds from there. The posterior third of the lower half of your face might be considered something like the masseter muscle and the jawbone. Things that we can do to increase and decrease it have been discussed in previous videos. And the anterior third of the lower half of your face is kind of the jowl and the perioral mound. That middle third is the buccal space. Everything kind of above the jawbone and below the cheekbone is what we can modify with buccal fat pad removal. Now, the buccal fat is distinct from the subcutaneous fat. This is not something that you can easily liposuction, although I think some surgeons do or attempt to do it, and it's certainly not something that I can go in with a FaceTite probe and try to radiofrequency ablate. This is something that can easily deliver itself through a small incision either inside the mouth or in conjunction with a facelift to a facelift exposure. Removing this deep fat will convey a degree of concavity to the midface, or at least flatness if you have a bulge there. There's a lot more that overlies it. I mean, bony anatomy, muscular anatomy, the amount of fat that you have in your face will affect the influence of buccal fat on your overall appearance and its removal. So what makes having buccal fat good? This is the crux of this video. Having buccal fat in place is basically a placeholder. It's basically like putting a grape inside your mouth. It kind of pushes everything outward. And in doing so, you get a degree of camouflage, of jowls, of masseteric hypertrophy, of any flaws or anything that creates shadows in your face. Having that deep space occupying lesion, if you will, pushes things out and kind of masks shadows and contour irregularities. So if you're a patient with a heavy face, or you have excess skin, or you have a big masseter muscle, by taking out that buccal fat pad, you will create a little depression. That's what most people want. That's what makes the operation successful. But the downside of taking that out in some people is that if you have a big perioral mound, if you have a lot of loose skin here, or if you have a jowl, then those existing issues, those existing cosmetic concerns may become more noticeable. And I will say, and here's a picture to show it, taking out the buccal fat does not give you jowls. It does not cause your skin to sag. If anything, the skin moves directly inward, not downward. And here's again a vector image showing in 3 dimensions the influence on an older gentleman's face of removing buccal fat. But in doing so, even though he looks a lot better and he's super happy, in fact, his jowls and marionette lines have improved, I can also say that it does give you depression and it does bring to light pre-existing issues that may have been masked by having a big buccal fat pad kind of pushing things out. So this is why the combination of buccal fat removal and some degree of liposculpture and radiofrequency skin tightening is so important. Because if you only address one issue in the lower half of your face, other pre-existing issues that are not addressed may become more apparent. I'm not going to say they always do, and I still think about 30% of the people that I do buccal fat pad removal on don't want anything else. That's all they want. They look awesome. They're super happy. But the other 70%, people with heavier faces, heavier necks, fuller faces, chubbier cheeks, things like that, would probably benefit from some degree of conservative liposculpture, radiofrequency skin tightening of both the perioral mound and the jowl at the same time. And so the combination of buccal fat pad removal and FaceTite as a single unit is super important to consider. Now, the other important consideration, again, and I've talked about this in numerous films, is my hypothesis that in many cases, removal of this heavy, hanging buccal fat pad on the inside of your cheek will also offload pressure on the jowls and perioral mound. So it's a smart decision to say, I want to do this in stages. Let's take out the buccal fat now and see if I'm happy with the result. Again, most people are. If you want more of an effect, if you want more treatment of the perioral mounds, marionette line, and jowls, then you can always come back and do some degree of liposculpture and radiofrequency skin tightening later. So buccal fat pad removal and some degree of jawline enhancement, either with masseter Botox or even an implant on the opposite side or fillers or something to modulate all 3/3 of the lower half of the face, is what makes my facial sculpting practice so comprehensive and so gratifying as a surgeon. If you have issues with the lower half of your face, and that again being between an imaginary line between the tragus and the modiolus of your mouth and the jawline, and you want to talk about how we can optimize it, it may be buccal fat pad removal alone, it may be buccal fat plus FaceTite, it may be buccal fat FaceTite and something to do with the jaw angle. This is all going to be an individual consideration. There's no one answer for everybody. I hope this video helps. If you have any questions, concerns, please do not hesitate to leave them in the comments section below, and please do subscribe, turn your notifications on, so on and so forth. Thank you guys so much, and I will continue to try to make more videos more frequently. Bye.